Hello guys, welcome to my YouTube channel. In this video we are going to discuss about pediatric case taking and the important questions that you will ask during the case presentation. First of all, we'll discuss about the headings under which the case should be taken. In that, first comes the particulars of the patient and chief complaints, history of present illness, past history, family history and obstetric history of the mother, in which it includes antenatal history, natal history and postnatal history. After that comes the developmental history, immunization history, nutritional history, anthropometry, general physical examination, systemic examination, provisional diagnosis, differential diagnosis, investigations, and finally comes the treatment. Now we'll discuss each headings in detail. First of all, we should mention who is the informant and whether the history is reliable or not. In particulars of the patient, we should take name of the patient, age, or if for more specific, we should ask date of birth and sex, whether it is male or female, and address where is the child resides, and date of admission, date of examination, and socioeconomic status. We can take in socioeconomic status whether it is BG Prasad classification or Kuposwamy classification. After that comes the chief complaints. Always remember the symptoms should be written in a chronological order with duration of illness. After that comes the history of present illness, and under this heading we should elaborate the chief complaints like onset, whether it is sudden in onset, gradual or insidious in onset, and after that comes the progression, whether it is gradually progressive or non-progressive, and duration. Any associated factors are present with these chief complaints, and postural variations, whether it is more during the sitting position or in supine position, any diurnal variations, seasonal variations, and if aggravating and relieving factors are present, then it should be mentioned here. Next, past history, whether any similar complaints are present in the past, any surgical history, any previous history of hospitalization with the same complaints or any other complaints. Next, family history. We should see any significant history is present in the family, any similar complaints in the family members. We should draw a pedigree chart, and when any congenital anomalies or any developmental delays are present in the family members. After this comes the antenatal history. We should see any consanguinity in the parental marriage and any maternal complications were present during pregnancy. Vaccination is done or not for mother. Exposure to radiation or drugs. Any infections during the pregnancy, and iron folic acid tablets were taken and regular antenatal checkups were taken or not. We should confirm and mention it. Next comes the natal and postnatal history. Mode of delivery we should see whether it is term, preterm or post-term delivery. Birth weight of baby, whether it is child is cried immediately after birth or not, and if not then resuscitation is done, and any NICU admission, any neonatal jaundice cases are present, etc. we should mention. Next, developmental history. It should be taken under 4 headings: gross motor, fine motor, social and adaptive milestones, and language milestones. And we should write age of attainment of all the milestones and any delays in attainment of milestones. Immunization history. Vaccination status of the child as per the national immunization schedule, any missed or delayed vaccination. Next, nutritional history. Type of feed, whether it is breastfeeding, weaning, formula feed or food. And we should calculate total calorie intake and protein intake. Also, we should mention what is the calorie intake and what is the requirement as per the age and what is the deficit in that child. Next is anthropometry. We should take height or length, weight, head circumference, chest circumference, and mid-arm circumference. We should also plot growth chart and under which standard deviation it should come. After this comes the general physical examination. In that, first heading is vital signs. We should take pulse, respiratory rate, and blood pressure, and also temperature. And after this, we should examine the head to toe examination. Next comes is systemic examination. Detailed examination of all the systems should be done. In that, it includes respiratory, cardiovascular, GIT, and CNS, etc. After complete history taking and the examination, we should mention provisional diagnosis, differential diagnosis, and elaborate all the summary of the case, investigations that have to be planned or that have done, and treatment that should be given or that has already given. With this, we have completed the outline of the pediatric case taking, and in the next video, we'll discuss what is the importance of each and every step and why should we ask the step, and also what are the questions that the examiner will ask during the case presentation. If it's a useful video to you, then don't forget to like and subscribe the channel. We'll meet in the next video. Thank you.